Hello, good student. Good student. I hope you're good. You're welcome to this class. Um, I'm Mr. Matters by name. I'll be the one to take you mental health nursing. This course is one of the interesting courses that we're going to take in this semester, and I'd like to inform you that you need to pay attention to every detail I'm going to share with you. It's not only going to help you in your academics, it will also change your life, change your perspective about things, and it will open your mind to the things that you probably don't know before or you have not been paying attention to. Having the knowledge of this mental health will help you also to manage individuals around you or people that comes your way or you meet on daily basis as the case may be. And I want you to understand that everything you learned does not justify that individual you're going to come in contact with had a major challenge. You're not a professional to ascertain that. So I don't want you to justify people based on what you learn. Before you can pronounce somebody is not mentally healthy, it must have been that it is verified with different cognitive factors and non-cognitive factors. And I also want to debunk a fact that most individuals used to, or most of the time, um, the case of mental challenge and mental health is usually um, discussed mm, or usually prompted to say that is a spiritual challenge. Most of the cases, many of these mental illness or mental challenge are not rightly spiritual. Yes, most of them are not rightly spiritual. They were they were things that should have been handled on certain level before it becomes a case that needed to now be managed medically. So there are little trigger things that comes from response of how we respond emotionally, how we respond um, intellectually, our personality, and the environment that surrounds us, the things that we take in from the environment. So quickly, let's take a look at the definition of mental health nursing. I said it's a specialty in nursing that focus on the identification of mental health issues, preventing mental health problems, and the care of treatment of persons that had psychiatric disorder. And when I said psychiatric disorder, I said it the other time that you can't justify until when you know, and that somebody is not picking stuffs in the street or you know, so not put themselves naked doesn't mean that the person does not have a psychiatric disorder. So just follow me as you learn today. This psychiatric challenge can result from different kind of things. It could be because of um, the child upbringing. It could be because of maybe the substance abuse or whatsoever. So there are different areas in this mental health nursing, but we might not be able to board ourselves with some of those information. So let's just go quickly. Let's take a look at the principle of psychiatric nursing. Number one is allowing clients opportunity to set own pace in working with problems. We are dealing with as a psychiatric nurse, when you're dealing with patients, you need to let them have the freedom to give them the opportunity to move at their own pace. You don't put pressure on them. Then nursing intervention should center on the client as a person, not on the control of the symptoms. The symptoms are important, of course, but are not as important as the personality. You don't look out for symptoms when you need to look after the client. I mean, the personality in quote. Now, as a principle in psychiatric nursing, you need to recognize your own feeling towards the client and deal with them. Very, very important. You don't have any reason to stigmatize your patient or your client. You don't need to see them for maybe a certain manifestation of the reactions that they profess. So every client you need to be able to help every client based on their needs. Then you are not allowed you don't need to allow a situation to develop or continue in which a client becomes the focus of their attention in a negative manner. No, you are there to maintain the serenity of the environment and to make sure that this client is not being seen or not being seen as someone who is not inclusive in the community. So if a certain client is having a bizarre behavior, just base your decision on intervene, or whether the client is engaging, you need to focus on. The decision must be on the fact that how to intervene if the client is endangering themselves or endangering others. So you don't just act impulsively. You need to ask for help when you're dealing with clients that are out of control. You can't deal with them alone. So if when you see a case is getting out of control, you can reach out to fellow staffs or a senior colleague to be of help in that situation. You need to avoid highly competitive activities when when you're dealing with your clients. You need to make frequent contact with the clients. Let them know that they want your time and effort. Don't forget that we're dealing with their psychology and they needed to be attended to well. So you need to remember to assess the physical need of your client. Very, very important. If there are other things that are happening to them apart from the psychiatric challenge that they're having, if they're feeling unhealthy on any other part of their body, or something else is wrong with their health, you need to be patient with them. Let them move on their pace and on their ability. Don't put them on pressure, like I said the other time. And when you're suggesting or requesting, you need to ask them to work better than commanding them. Yes, you just suggest to them instead of commanding them and forcing them to do what you want to do. It's better you request them to do it or you suggest to them that it's important that they do what you were suggesting for them to do. You need to do a therapeutic thinking. Very, very important. You need to be honest with your client. Um, you need to make reality interesting enough that the client prefer it to their own fantasy. You need to be able to paint picture in such a way to please their fantasy. You must understand that there are some of them who are going to be living the fantasy of what, not in the realistic reasoning. So you must be able to be able to relate with them, so that whatever you're sharing with them will go with their fantasy. The role of a psychiatric nurse as follows: provision of a safe therapeutic measures. That means you need to be able to think with them. Yes. Number two is working with the patient or client on the real day-to-day problem they face. You must be able to guide them. You must be able to identify their physical aspects of the patient's problem. If peradventure the damage or the condition has led to um, a damage or a dysfunction of any part of their body, or it has caused hurt, it has hurt them on any aspect of their body. You also need to assume the role of a social agent, like a parent for the patient, so that they can be open enough and you'll be able to rehabilitate them. You need to conduct a psychotherapy. You need to provide a clinical assistance for other nurses and healthcare workers in dealing with these psychiatric patients. Let's quickly take a look at some disorders that leads to that are relative to mental health condition. The first one is anxiety disorder. It's a type of mental condition. If an individual has it, the person will be responding to certain things and situations with fear and dread, and that the individual may express a physical sign of anxiety, which can include, sweating, pounding of the heart. The anxiety also can result to a nervous impulse, anxiousness, nervous impulse, anxiousness. It could also result to the fact that the individual might be having problem with taking important decisions just because of this um, anxiety disorder. So they are faced with fears on situations. So let's take a look at people who are at risk of anxiety disorder. People who are at risk of this anxiety disorder sometimes, get or at risk of this disorder because of a behavioral pattern or environmental factors. Most of the time, it could be genetically probably coded in their DNA. It was a result of the environment that they live in or the environment that they grew up from. So over the times, this anxiety disorder, most of the cases actually have a relationship with their upbringing. So let's take a look at it. It could be a certain trait. It could come with personality trait like being an introvert, being shy, a behavioral ambition that makes people very, very uncomfortable, unfamiliar with people, um, not too okay with some certain environment or situations. It could be a personality trait, yes. It could result from a personality trait. People who have such personality might be at the risk of anxiety disorder. People who have stressful or traumatic events in their childhood or in their adulthood have the tendency to have anxiety disorder. People whose family history they have an history of anxiety in their family also have the tendency to have this anxiety disorder. People who have a certain physical condition, maybe um, a particular case, it could actually trigger this anxiety disorder. This anxiety disorder um, happen more in female, but the research might not be able to prove that 100%, but it was due to the fluctuation of the hormone production in females, and that's the testosterone hormone, which is actually that plays a role in is the flight. It could also be could also work as um, a flight hormone in the body. So individuals who have multiple cases of this might have it that they had the testosterone hormone produced in certain level in their body. So let's take a look at types of anxiety disorder. We have about four of them. We have a generalized anxiety disorder, we have panic disorder, we have phobia, then we have separation anxiety. These types of disorder are different in their forms and in their symptoms and their manifestation. The generalized anxiety disorder is just a a feeling of extreme worry and tension. So it is not necessary that something is going to trigger this individual to feel worried or to be under tension or to be under duress. It could just be that they just realize that they are worrying about almost everything about their life, from worrying about work to worrying about family, from worrying about family to worrying about their academics to worrying about their relationship, and it could be on and on and on like that. And before you know it, they are moving from one part of their life, getting worried or having tension, having fears about one part of their life to another part of their life. And the physical symptoms that's peculiar to this generalized anxiety disorder is that this set of people uh, are very, very restless. They are faced with a very high level of restlessness. Set of people like this does have a sleeping problem. You hear people saying, I've not been sleeping well, I've not been able to sleep for 2 days. My sleeping pattern, I'm not okay with. So it could be a symptom of this general anxiety disorder. People also demonstrate symptoms of difficulty in concentration. They face difficulty in concentrating. They want to concentrate on something, but they easily lose focus on concentrating. So it could be a symptom that this individual is having a um, generalized anxiety disorder. Let's take a look further into panic disorder. This panic disorder is more intense than generalized. So it comes like a sudden panic attack, and the attack can becomes more stronger with more intense feeling than generalized anxiety disorder. Usually, it could be triggered by maybe a particular thing that is dreadful to the individual, or it could be triggered by an occasion. It could be triggered by sound. Yes, it could be triggered by sound. It could be triggered by whatever that scares the individual. So what makes it could even be triggered by an alarm. Yes, a sudden alarm. So people who have this kind of panic disorder have the chances to have a heart challenge, maybe a heart attack challenge. Yes. So during a heart During the panic attack, there are things that are possible. The individual might experience sweating. Uh, Obviously, the individuals will have heart palpitation. Uh, Part of the happenings or occurrence that could surround this individual is chest pain, the feeling of choking as a result of the panic attack, which is would have results into maybe heart attack, or you know making it more difficult for the individual to be able to breathe well as a result of the shock, which could be affect which could have affect the rate of the heart rate. So another factor, another disorder is phobia. Yes, this is an intense fear for certain situations or objects, and people demonstrate this kind of phobia in different things. It could be triggered, is usually triggered, even when sometimes the individual is trying to avoid it. It could still be triggered. Yes, it could be triggered. It for some, if it has the manifestation have been so serious with them, can actually make them to avoid everything throughout the day. Yes. From having fears of one thing to another thing, and they begin to have maybe like um they can start hallucinating a particular thing, a particular image. So people tend to have fears for blood, the fear for flying, the fear of heights, the fear of injection, the fear of animals. Yes. So let's take a look at another disorder. We have a social anxiety disorder. Social anxiety disorder. These individuals have the tendency to be overwhelmed by worry or be so conscious of themselves to a level that they they felt odd or felt different in the midst of people, or they felt that uh, people they are so anxious that people might judge them or people might embarrass them. So they tend to start avoiding social contact. They might start avoiding people, having contact with them, greeting them, connecting with them, being sociable, snapping pictures, being around them, making them feel social, making them laugh, and so on. So another type of phobia is agoraphobia. Agoraphobia. This is a case of agoraphobia as an intense of fear, being overwhelmed, unable to get help. Yes, it comes from the environment. The individual would prefer to lock themselves up in an enclosed place. They prefer to stay or have fear for um, space, a broad place. If they are moving towards, they need to pass a route, they are scared of using the place without support or help. So they're always scared of not finding help. Yes, very scared. So another type of disorder is separation anxiety disorder. This one is very, very more common in children and teens. So before you know it, the child is separating himself by fear that the parents might want to hurt him or her. You start saying maybe he or she was embarrassed or intimidated by a fellow student. They can pick it up, and before you know, they are, you know, staying alone, separating themselves from the is more a bit closer to social anxiety disorder, separating themselves from um, the individuals. So most times they might be scared of their parents, uh, of their parents hurting them, or scared of their teachers hurting them, or scared of somebody who seems to be a threat to them hurting them. So we have symptoms of an anxiety disorder. We have physical symptoms um, that is visible, the heart palpitation. Um, the individual will have the tendency to start having dry throat or dry mouth, muscle tension, shortness of breath, numbness of the hand or the feet. Could be a symptom of anxiety disorder. Uh, when somebody begins to have a cold, sweaty hand, yes, a sign of anxiety disorder. A sign of anxiety disorder. Behavioral symptoms could be inability to be still or calm. The person will have trouble in sleeping. They may have a ritualistic behavior. It could be washing of hands. It could be um, going out of the door and closing the door. Go out of a room, close the door again. Close that. Go out of the room, close the door again. Or picking something multiple times. Like the person will pick it, drop it. The person will pick it again, drop it. The person will pick it up, drop it again. So when you see symptoms like that, is a symptom of anxiety disorder. There are medications that could be used to treat um, anxiety disorder, but what you need to understand is that naturally anxiety disorder cannot be cured with medication. Yes, the medication can only help to reduce the symptomatic effect. Yes, it will help to improve or to reduce the symptomatic effect. So if the person is having a case of being depressed, the person will be given an antidepressant drugs. Are you getting what I'm saying now? So we have anti-anxiety medications. There's an example there that I attached there for you. We have antidepressant drugs which will work for patients who are depressed. So it makes them to talk, um, makes them more sociable, you know, steaming up their system and regulating their moods, just tweaking their brain chemicals that their moods can be improved and reduce their stress. Then we have another one which is beta blockers. These beta blockers work um, more for regulating the blood pressure. Yes, especially for people whose case might be relative to panic, the panic disorder, close to the heart attack that I mentioned the other time. Then we have anti-anxiety medication. It's just to track the brain chemicals, as you can see. So you asked and said, okay, if these disorders are happening or this disorder, how could we manage this disorder? Because obviously in your mind now you might have started thinking, okay, oh, I know of somebody that has these symptoms. I've realized that this person is actually suffering from this, so now I know. So there's a way to cope with this um, disorders. The first one is that the individual needs to learn a way to manage stress. One of the most commonest challenge that brings about mental disorder, anxiety disorder, or any mental um, case, most of them actually result from stress. And when I say stress, there's a level of stress that begins to affect your mind. There's a level of stress that once your body is affected, it affects your mind. Your mind is not stable. So people need to learn how to manage their stress. People need to also engage in groups, yes, both in person and online and offline. Don't be alone. Yes. So you can join a support group at work or wherever you have to cope with the anxiety disorder. The individual also need to learn about the type of their disorder and know how they can manage it. The individual should limit the intake of caffeine so that it will not worsen the case and increase the symptoms. The individual also need to talk to the healthcare providers to know how the medication is working, ask questions about their medication, have the contact of their provider should in case there's a sudden attack so that they can reach out to their healthcare provider. Let's take a look at depression. Depression is a feeling of deep sadness. Yes, when somebody often feel less of themselves over and over and over and over again. At times, feeling less of themselves, and people feel like okay, they're not getting what they they feel like they want to get about their life. They always have a feeling of hopelessness and less worth of them. So sometimes some of them think that life is not worth living. So that's depression. And we have a case of bipolar disorder. This bipolar disorder comes in episodes. Yes, comes in episodes. Sometimes called manic depression, because it causes extreme mood swing. Extreme. Yeah. Sometimes the individual will feel extremely energized, happy with full energy, and all of a sudden, the person will have another switch to another mood, all sudden, like uncontrollable. So if proper treatment is not taken, an individual might continue living like that for the rest of their life. An individual can continue living that way for the rest of their life. There's another disorder that you need to be familiar with. It's called the affect disorder. This affect disorder is widely used in psychology, especially when psychiatrists or psychologists are doing some therapies. And you can ask that what are the causes of the affective disorder. It was not has not been verified that there's actually something that actually causes this affective disorder. They were just responses of stress, trauma, or certain physical illness or medications that has been, those are the informations that have been traced. And this thing I just mentioned, we have changed the chemical composition of the brain of the individual or affect, making them to act the way they act, making where they talk the way they're talking. And this affective disorder happens to people of different race, different age, irrespective of their income level. So we have, let's take a look at the affect disorder. We have the broad affect, we have the blunted affect, we have the flat affect, we have the labile affect. So we have this affect in different so we have this affect in different forms. Um, let me show you. Let me take you through it. We have the broad affect. You see, we have the blunted affect. We have this individual. When something happens, they feel it's. They can respond to it as if nothing happened. So to see, we have flat affect. Then we have the labile affect. I'm just trying to move very fast so that I can touch some other things we needed to deal with. And let me introduce you to what we call self-harm and suicide. And, it's on this self-harm and suicide I'm going to cap this class. Self-harm has been referred to as a preoccupation with deliberately hurting oneself without conscious suicidal intent. It often results in damage of body tissues. This self-harm is also commonly known as self-injury behavior, self-mutilation, non-suicidal self-injury, suicide, or deliberate self-harm. Sometimes some people call it self-abuse. Some also call it self-inflicted violence. So although the self-harm is not the same as suicide, there's a major gap between self-harm and suicide. And you must understand that. You must understand that. You must understand that. So although self-harm is not the same as suicide, yeah, but self-harm can escalate into suicidal behavior. Yes, the intent to die can change over time. For an individual who is, self-harming, the individual can later change, you know, their decision instead of committing suicide. But a study found that almost half people who self-harm reported at least one suicide attempt. So that shows that somebody that is self-harming has a tendency to consider suicide, has a tendency to consider suicide. So let's take a look at self-harm. Uh, self-harm can how self-harm can lead to suicide. How self-harm can lead to suicide. Self-harm can lead to suicide once it is no longer a coping method for the individual. One of the reasons why people self-harm is because they just want to relieve themselves of the pain of what they are feeling. They want to offset the feeling that they were having, or they want to offset the stress that they're having or the trauma that they're having. So in a crisis situation, A self-harmer who have become desensitized or habituated to the pain through repeat episode may view suicide as the next attempt because the person has been trying, has had different episode of self-harming, and the individual feel like, okay, I'll be harming myself and I still don't feel satisfied. So why not considering suicide? At least if I consider suicide, I know that I will be satisfied. So self-harm can become suicide. It is actually recommended that every patient who self-harm should be assessed for suicidal risk. Very important. Let's take a look at the risk factors that put people on self-harming. Factors that put people at the risk of self-harming. We have a case of people who have lost a parent, childhood illness or surgery, or childhood sexual or physical abuse can put a person at the risk of self-harming, or a negative body image perception. Yes, this could be relative to individual who are inclusion. Maybe a particular part of their body was not properly developed or they felt is not properly developed. Because there are cases of people who self-harm not because they don't have a complete part of their body, but they felt that it's not okay to them, or they feel like it's not the way it should be. You can imagine somebody might actually be obsessed about the fact that how their own size of nose was different from the other family members, and if it's not taken, they can start thinking that okay, maybe they were born out of the family, or maybe they are not part of the family. So it could reach that's a a negative perception of a body image, a lack of impulse control. Some individuals can actually control their impulses, and it could put them at the risk of self-harming. Yeah, a childhood trauma can make somebody to self-harm. A feeling of neglect, um, lack of strong family attachment. Some individuals have never seen their family since they've been alive, as far as they could remember. Some haven't don't even have a feeling of family. They don't have a strong emotional connection to somebody that they could call family. So there's no family attachment. So as I cap this class, let me take you through the habit of self-harm individuals. Now, this is where I need to put a caution. I need to put extreme caution. When I said habits, when we're looking at this habit, does not justify that individuals that go through this habit or that tends to have this habit are self-harming themselves already. No. Just like the same way of the risk I just mentioned, we're only saying that it could be things that you can look out for in people which could actually lead them to self-harming. So if you know these things, you can help them, counsel them, or guide them, or you find them to uh, a, a mentor nurse or a psychologist who can be of help or guide them in counseling, as the case may be. But when you see people that they appear to withdraw, be quiet or reserved than usual, it could be a sign that they are heading towards self-harming. When people stop participating in their regular activities, you need to make sure that you reach out to them so that they won't head up self-harming themselves. People have rapid mood changes. Just keep at watch on them so they don't begin to self-harm themselves. When people get angry or upset easily, it could be a sign that they've probably been self-harming themselves in one way or the other. And when people have had a significant event in their lives, yes, maybe they have to break up with a significant event in their life, trying to break away from a particular family member, or break away from their peers or break away from a loved one, and, and they find it difficult to do that about a particular thing about their life. It might not be relationship, it might be academics or whatsoever. So, and you see that they are struggling with it, please reach out to them so that they don't begin to self harm themselves. When people suffer for academic school performance, like I said, uh, when they usually do well before, it could be a fact that they are probably or might want to consider self harm. When people exhibit unexplained cuts or scratches on their body, please, it could be a sign that this individual have started self-harming themselves. Then when people wear clothes that are inappropriate for wedding, you know, it's a sign of disorder. Yes. When somebody wears, you see somebody wearing consistently sweater when there's a hot sun or a very high level of temperature, a sign that the person is going through a certain disorder. So as I'm going to cap it, I encourage you to make sure that you read further uh, and do well to prepare yourself for your assessment. And don't forget to, you can take a look at this material all over again to understand some of the things I've discussed with you. So do well, do have a wonderful time. Thank you.